Okay, so I received my blood from the blood bank, and normally I would have another nurse to do my 3 checks with, but I don't have another nurse, so we're just going to assume that I've already done my 2 checks outside of the patient's room. I would have been checking the tag, the physician's orders, and the dispense document, and also just making sure that the blood here matches up with the tag and the dispense document in terms of the product or blood type. So I'm inspecting the bag. I'm looking for any abnormalities in it, any clumping, anything like that, any like holes in the bag, and it all looks good to me. So I'm gonna do my final check at the patient's bedside, and like I said, normally I would have a second nurse with me to do that. So I'm gonna go in and see my patient. So, hi there, Kelly. Yes, Kelly Boyd. My name is Julia. I'm gonna be your nurse today. And what we're gonna be doing today is we're just going to be hanging a bag of blood and attaching it to your IV. And has your doctor already been over this with you?
Yep.
Okay, perfect. And you have signed your consent form, I see. I just want to go over this with you. So I'd go over the consent form with the patient and just make sure that they've signed all the proper things that they need to be signing, and I see there's a spot for the physician to sign as well. So just making sure I have consent at the time of the blood administration. So next what I'm going to do is I'm just going to look at the patient's bracelet. So can you tell me your first and last name?
Kelly Boyd.
Can you spell your last name for me?
B-O-Y-D.
Perfect. And I'm also just comparing with the dispense document and the physician's orders and the patient's bracelet while the patient is telling me their name and their birth date, which my patient might not know his birth date. Can you tell me your birth date, Kelly?
1605-72.
Perfect. And that matches. And then
72.
Yes, 72. And the next thing I'm going to be doing is I'm just going to check the MRN number on my patient's bracelet. So it would be saying 754, and I'm matching also on my other 2 documents 28324. Perfect. All right, so I know that my patient is in fact the one I need to be giving blood to. So that's good. So the next thing I'm going to be doing is setting up normal saline. And the reason that I'm doing this is just in case my patient experiences any adverse reactions. I want to make sure that I have a bag of normal saline hanging because we'll need it. So I really hope that you can see in my video that it's my normal saline bag. I'm going to hang it here on my pretend IV pole, and I'm going to be using my tubing that I have available, and I'm just going to quickly prime the line. So I want to make sure I'm closing this so I don't get a shower. And using aseptic technique, I'm going to remove that cover, stab the bag. Now I'm just going to squeeze it in there. And I'm going slowly to make sure that I'm not getting any bubbles. And I'm using gravity. So really long tubing. So it's taking some time. Let me see here. Fluid. And I'm just going to let the excess run into my garbage here.
No.
Perfect. Okay, and I didn't touch that end. It is still sterile. So this is my backup. Just in case my patient experiences any reactions to the blood administration. Okay, so now that that's all set up, next thing I'm going to be doing is I'm just going to be checking my patient's IV site. I'm looking for signs of redness and swelling, and I'm not seeing anything like that. Patient, is this painful for you at all?
Nope.
Perfect. Okay, perfect. So, and it hasn't been, it's not in use for any other medications right now. Nothing else is attached to the Y site, so I feel pretty confident that I can use this IV site to administer my blood. And it's also in quite a large vein, and the gauge is large enough for me to use it as well. So that's perfect. Next thing I'm going to be doing is my final check. So I've already checked my patient's ID band, and now I'm just going to be checking the tag on the blood, the physician's orders, and the dispense documents. And like I said, I'd be doing this with another nurse. So I've got Kelly, K-E-L-L-Y, perfect, B-O-Y-D, Boyd, Y-D, date of birth is 16/05/72, perfect, MRN 754 283 24 24 24. Perfect. And also just checking, the bag says ORH positive, the tag says O positive, and the dispense document says O positive, so I feel confident that I can use this blood for my patient. So next what I'm going to do is I'm going to hang the bag of blood. So I'm going to hang that up here. And I'm going to be using this tubing, and now because I was just touching some documents that I was touching outside the room, I'm going to wash my hands again with soap and water for at least 20 seconds, and I would be drying using sterile technique with paper towel, which I don't have available right now. So my hands are clean. I'm going to put on some clean gloves. And like I said, I'm going to be using the tubing that has the filter for the blood. And I'm going to set it up with when I'm ready to go and attached to my patient, I will be setting it with a rate of 1 milliliter, 10 drops per minute, which is approximately a milliliter. 1 milliliter, because that's what's recommended on my packaging here. So I've got my clean gloves on. Got my tubing here, the filter. I'm going to close this so I don't lose any blood when I stop the bag. This is the part that I will be attaching to my patient when I'm ready. So, keeping everything sterile, I would be popping that off and not touching any of that. Taking off this top and stabbing blood. There we go. And I think just before there, when I pulled it off, I slipped my fingers, but I'd be very careful not to be touching the inside of that. So the next thing I'm going to be doing is, and I hope you can see what I'm doing on the camera, but I'm pinching the chamber. And I believe I'm getting enough blood in there to cover the filter. Okay, so now I'm going to prep the line, and I'm going to do this really slowly because I don't want to discard any of the blood into the garbage, so I'm going to go super slow. I don't want any bubbles. So if I'm correct, it should fill only to about like about half, and then it should start coming into my tubing. So it's coming into my tubing now, nice and slowly. You can see it running through. I don't have any bubbles. Okay, and I'm going really slow now so that I get it right to the tip. So I don't get any bubbles for my patient. Okay, so it's right at the end now. I'm going to lock that. So next what I'm going to do is I'm going to do a flush of my patient's IV to make sure it's just like cleared of any other possible medications or anything like that before we start with this. We don't want to mix the blood with anything. I mean, ideally it should be normal saline in there from the last saline lock, but you never know, it's better to be safe than sorry. So I'm just going to do a quick flush and then I'll hook up my blood. So I'm just going to attach this here. So it's ready to go, all clean, ready. I'm going to clean the port for 30 seconds. And 30 seconds has passed. And then I'm going to attach my flush, keeping sterile technique. And I don't want to get my patient all wet here, so let's just pretend I'm doing push-pause technique to flush this IV. And I'll do my final push and lock, and then I'm good to go here. So my IV is ready to go. Now I'm going to clean it again. With a new alcohol for 30 seconds, and 30 seconds has passed. And now, keeping everything clean and sterile, I'm attaching my blood to the IV, and I will open this so that I can run into my patient. And then, like I said, I'm not going to do it because I don't want to get my patient covered in red food coloring, but I would be putting it at drops of 10 drops per minute. And I'm going to be giving this to my patient to say, you've had a blood transfusion, you should keep this on you for the next, I think, year, just in case anything happens. And I'm going to stay here with my patient for the next 15 minutes to make sure that no adverse reactions come about. And if they do, I'm here ready to go. I would disconnect the blood and hook up the normal saline I have here. And I'm going to tell my patient to tell me if he's feeling any difficulty breathing, any itchiness, rash, headache, chills, that kind of thing. And in 5 minutes, I will be doing vitals with my patient to be monitoring for fever and, again, any other adverse reactions. Thank you.